history. The government says many demands have been addressed, such as retirement age raised to 65, arrears paid, hazard allowances under review, over 10 billion released for medical residency. Both things can be true, but here is the policy gap. Agreements are signed but not delivered evenly. And while government and unions debate percentages and circulars, patients wait. Laboratories shut down, blood screening slows, diagnoses are delayed. In Lagos, medical laboratory directors have warned that critical services, including safe blood transfusions, are already at risk. Zoom out and the picture gets even worse. Nigeria spent less than 4% of its national budget on health, far below the 15% Abuja Declaration target. We already have one of the worst health worker to patient ratios in the world. So when health workers leave, and they are leaving, the system doesn't bend, it breaks. They are migrating to the UK, Canada, Saudi Arabia, not out of disloyalty but exhaustion, because honestly, burnout doesn't pay rent. And when public hospitals slow down, private hospitals get busier and more expensive. Healthcare quietly becomes a luxury. That is why this strike matters. It's not just about pay, it's about parity, fairness, and whether government hospitals are meant to work for everyone or only those who can afford alternatives. So, what should happen next? First, honor agreements already signed, no new promises, just delivery. Second, treat healthcare as essential in budgets, not speeches. Third, fix inequality inside the system so one group isn't permanently favored over others. Because 53 days without public health workers is not sustainable. This is not just a labor story, it is a human one. And the longer it drags on, the louder it asks the same question. Who is Nigeria's healthcare system really built for? That is what 5 minutes around the world is about. Not just what happens, but who it affects, why it matters, and the questions we wouldn't stop asking. I am Judith Trust, and I'll be taking you around the world in 5 minutes.